A surge of fear, some even call it a pandemic of anxiety, is sweeping immigrant communities as aggressive immigration enforcement pushes patients away from the medical care they desperately need. The effects are startling and the consequences ripple far beyond individual households. But here's where it gets especially tense. Long-standing, trusted health clinics are now seeing dramatic declines in patient visits, eclipsing even previous waves of political crackdowns. Dr. Jacob Sweidan, who has dedicated 4 decades as a pediatrician to low-income families in Southern California, has witnessed everything from federal immigration raids in the 90s to heated debates about birthright citizenship and publicized workplace sweeps under President Trump. Yet now, he reports, families are more afraid than ever before. Parents let their children get terribly ill before even calling, he explains. He's had to send toddlers to the ER after parents waited days with high fevers and treated a teenage diabetic in a near coma because the family was too scared to go out for insulin. After shelving telehealth appointments post-pandemic, Dr. Sweidan and many colleagues have been forced to revive them as stepped-up enforcement drives even U.S. citizen children deeper into isolation. This is the part most people miss. Telehealth isn't just a convenience. It's now a lifeline for families who would otherwise go without care entirely. What's fueling the current wave of fear? A key turning point came when the Trump administration reversed a policy that protected sensitive locations, hospitals, schools, and churches from immigration raids. With these traditional sanctuaries now under threat, many clinics have dusted off their COVID-era playbooks, expanding telemedicine and home visits to meet patients where they are, often behind closed doors. Clinic directors across the country, like Sarah Rosenbaum from George Washington University, say they've never seen such a dramatic drop in in-person visits by immigrants. Every community health center is feeling this, Rosenbaum confirms. The numbers back it up. At St. John's Community Health in LA, telehealth visits have tripled, jumping from 8% to 25% of all appointments in a matter of weeks, according to CEO Jim Mangia. In response, the clinics are also offering in-home services, teaching staff how to handle warrants, and registering patients for virtual care, anything to reach people who are growing invisible out of fear. Yet the reality is even more sobering. Mangia reports alarming encounters, federal agents trying to access patients during clinic visits, ICE contractors staking out hospital rooms, and even armed confrontations with clinic workers. Federal charges have been filed against health workers accused of standing in the way of immigration arrests, a legal gray zone that could spark heated debate on both sides. For patients like CS, a 71-year-old immigrant from Huntington Park, the threat hits home. She skipped vital lab tests and specialist appointments, unable to risk even a bus ride. She voices what many feel. If I can't get the care I need, my condition could get much worse. It's a stark, emotional reality that goes beyond statistics. Federal health officials have so far declined to address these mounting concerns. Meanwhile, the legal landscape is shifting as federal and local governments clash over the scope and tactics of immigration enforcement. Courts have stepped in, for now, to restrain some of ICE's activities, but the uncertainty adds another layer of anxiety for families and providers. On the local front, LA County is working to expand virtual care in response to surging demand for phone and video appointments. And lawmakers are pushing protective legislation to limit immigration agents' access to healthcare spaces. A move that some see as overdue, but others worry could create its own complications. Colorado has already implemented similar laws. But here comes the controversial question. Are these short-term adaptations actually sustainable? Many experts argue that a full reliance on telehealth falls short. Emergency rooms are bracing for more walk-in crises, Medicaid cuts threaten to further overload hospitals, and critical hands-on services like lab tests simply can't be done through a screen. Isabel Becerra, head of the Orange County Clinic Coalition, points out, telehealth is a great stopgap, but what happens when you need a physical exam or urgent procedure? At the same time, the digital divide presents its own set of barriers. Families may struggle with technology, language, or basic internet access, making telemedicine far less effective for the most vulnerable. Even naturalized citizens like VM in Southeast LA confess to living in a constant state of vigilance, wary of going out and relying on others for basic errands. Emotional distress is soaring. Depression and anxiety are on the rise, compounding physical ailments and drawing out a dangerous pattern of delay and deterioration. VM insists, someone needs to wake up. If not, people will suffer and even die out in the streets. Is the current patchwork approach of telehealth and home visits a viable bridge? Or are we dangerously close to letting a fear-driven crisis spiral out of control? Now it's your turn. Do these stepped-up immigration policies go too far in compromising public health? Or is expanded telehealth an adequate solution for now? Should medical spaces be shielded from law enforcement entirely? Or are there limits? Let us know where you stand in the comments. Let's spark a real conversation. This account is based on reporting by KFF Health News, a nonprofit newsroom specializing in health policy journalism.